Hi, I'm Dr. Dan Ladizinski. I'm the CEO of SUTUREGARD, plastic surgeon by trade. HEMIGARD ARS, adhesive retention suture, is the first of its kind hybrid of suture and adhesive tape technology. It has the accuracy and anatomic alignment capability of conventionally placed suture, but has the gentleness of tape. And what this combination allows is for one to place high tension on a suture without injuring the skin the way a suture would if placed by itself. It's very easy to use. This is an example of a melanoma excision. Two adhesive strips are applied, one on either side of the wound. The suture is placed through the holes and through the tissue full thickness, equal depth on both sides. Then the suture is tied. We're usually using 2-0 or 0 nylon, high tension closure. And then once you've tied the HEMIGARD, all the tension is managed and the subsequent closure is easy. I put a couple dermals just to align the skin correctly. And in this case, glue was used. Here you have only one external suture, and this is our COVID-19 closure because the one external suture can be removed by the patient easily and atraumatically at home because it rides above the skin. No undermining is done with HEMIGARD closures, which has lots of advantages. One, the undermining can damage perforators, and here you're avoiding that. Also, you're not creating a pocket that can result in a seroma or hematoma. You don't have to anesthetize as large of an area either. So many advantages. How is it that you can apply high tension to a HEMIGARD? Well, it's engineered specifically to act like a spring. There are three zones with different elasticity. The head is inelastic, elevates the suture above the plane of the skin. The body has intermediate elasticity, and the tail is very elastic. So when you apply high tension to the head, the tension is dispersed over the entire structure such that when it reaches the tail, there's very low tension and you don't get trailing edge blisters. And because it's a spring, you can load it with a lot of force and the adhesive doesn't fail and tape doesn't pop off, nor does it tear. When you look at the pressure tracing with HEMIGARD versus a conventional retention suture by finite element analysis, you see two very different pictures. Red here is high pressure. This is a 2 kilogram, 20 Newton load, like 2 bags of saline hanging off the suture, a lot of tension, a lot of pressure. On the right, you see a conventional retention suture. Of course, that suture encircles and compresses the skin, and in doing so, creates a high pressure footprint that can impact blood flow to the skin edge, can tear the skin. On the left, the same exact load with HEMIGARD creates a totally different pattern. It really works like a snowshoe in a way and laterally diverts the tension far away from the skin edge such that there's really minimal effect at the skin edge. And this is really quite remarkable that you can apply high tension to the skin without affecting the skin edge blood flow. And that has a lot of benefits, especially when you're dealing with patients with marginal perfusion. Um, One benefit is you don't tear the skin as easily. The insert is very stout, and especially this is manifest as a benefit in patients with frail, delicate skin. But even patients that have normal skin, when it's under high tension, you can apply a great deal of force without tearing the skin. The perfusion benefit is quite remarkable as well. This is a melanoma on a back that was closed with a couple of 0 nylon retention sutures by my co-inventor and partner Bill Lear's resident. The resident closed this under high tension with lots of staples and these 2 retention sutures. Bill saw the amount of blanching from the sutures and said, "No, that's too much blanching. We might get necrosis here. Let's try HEMIGARD." He put in a single HEMIGARD with #1 nylon, still under very high tension. But because of the effects of HEMIGARD, the tension was diverted away from the skin edge, and you can see the skin edge perfusion is much better. Fewer staples were necessary. So we saw this many times and followed it up with a quantitative study with a laser speckle analysis that looks at blood flow in a non-invasive way. In this example, red is more blood flow and blue is less blood flow. This is a leg wound closed by a single suture. The left side is hemiguarded, the right side is not. And I think you can see that there's more blood flow on the hemiguard side. Another important benefit is I mentioned HemiGuard elevates the suture above the skin. This is especially useful on plantar skin. What we're seeing here is a 10-day post-op wound closure of a neuropathic heel ulcer closed by a podiatrist. And he happened to put a HemiGuard suture right next to a conventional retention suture. And see the difference is quite striking. The HemiGuard suture is still riding above the skin, not cutting through, still holding the tissues in opposition. The conventional suture has sawn through that softened, macerated skin, and as it has done so, there's less volume in the suture, and the wound starts to gape. And this was it's a common experience with the plantar closure because that skin does get macerated and it gets very soft, and it's easy for the suture to cheese wire. We just published a wound dehiscence study, which had absolutely remarkable results. We were able to very significantly reduce wound dehiscence in lower extremity surgery for excisional wounds after skin cancer removal. We looked at 6 months of outcomes before HemiGuard adoption and 6 months after. In the 6 months before, the dehiscence rate was 24%, which is similar to that reported in the literature. In the 6 months after, there was one case that dehisced out of 37 patients. And in that patient, the dehiscence occurred 4 days after the HemiGuard was removed. And that speaks to an important point. You leave HemiGuard on as long as you feel necessary, and that's your clinical judgment. If the patient's on steroids or very edematous or non-compliant, many reasons you might leave the HemiGuard longer. And perhaps if that one dehiscence had their HemiGuard on an extra week, it might not have dehisced. This is the type of wound they were dealing with. And again, this is a squamous cell cancer pretibial. Closing this with no undermining, just putting a high tension suture here, creeping and stretching the skin, which another benefit of that is you change the shape of wounds from rounder to more elliptoid, and that makes less dog ears to close. So again, benefits of no undermining, no damage to perforators underneath, no pockets for seroma hematoma, smaller area to anesthetize, no dog ears to chase, lots of advantages. So these doctors started using HemiGuard in the 6 months prior to HemiGuard. They only closed 48% of their post-excisional wounds. The rest they'd left open to heal by second intent. Once they adopted HemiGuard, the closure rate went up to 90%. It was a remarkable change in their practice. First of all, they were seeing way less patients back for second intent wound checks, which created a lot of time in their practice for seeing new patients for doing surgery. And of course, patients were happier with more of them getting their wound closed, quicker return to pre-op activity. And they also billed more because they were billing for excision and billing for closure. Foot and ankle surgery has had a lot of use. Some of the indications have been amputations. This is a 4-foot gangrene that was acutely done as a TMA level, and then the tendon sheets opened and wide drainage. After 4 days of washouts and IV antibiotics, patient effervesced and no gross pus and no erythema. So the doctor here revised it to a Lisfranc level and closed one layer over the bone and then a single layer soft tissue closure with HemiGuard and with some interrupted nylons in between. You can see the HemiGuard takes all the tension, and these are not big retention sutures in between, just simple interrupteds. HemiGuard's doing all the heavy lifting. And this was a very fast closure. And importantly, you avoid subcutaneous or dermal sutures, which in a case that's previously been infected, we know there are bacteria in the wound, and those bacteria can lodge and proliferate on the deep sutures and lead to a stitch abscess or worse. This next patient type is really why we invented HemiGuard. This is elderly woman whose chin was bumped with a car door, and this her skin is so frail it caused a terrible laceration. I really struggled with patients like this because even though there's no skin missing, the sutures will tear through it very easily. If not right away, it's after they swell a little bit. So here, this patient was closed under local anesthesia with HEMIGARD, which is an amazing outcome. No prolonged wound care, no wound vac, no general anesthetic. Yeah, the HEMIGARDs were left on for 4 weeks. Patient ambulated home from the office and had a great, simple recovery. This is a Charcot repair after 5 hours of fusion surgery. The HEMIGARD was applied as a single layer soft tissue closure after the bone had been closed deep over the hardware. Uh, the HEMIGARD here is used using both holes in the HEMIGARD for a vertical mattress pattern, which gives you a little more skinny version. The key image, I think, probably the most important picture you'll see in this deck is post-op day 5 on the upper right. This is when most wound dehiscences occur. It's somewhere in that first or second week when the edema is at its peak. But what you see here is that the HEMIGARD is stretched like skin. I mean, it's remarkable in its elasticity in that it can accommodate the increased volume of the swollen foot, but at the same time continue to support the suture line repair. And in this case, you use your judgment. How long do you leave the HEMIGARD on? Well, the doctor waited till the edema went down significantly and removed the HEMIGARD after about 3 weeks. And this was the appearance immediately afterwards, and patient had pretty much primary healing. Interestingly, the same patient had the same surgery on the other foot, and by the same surgeon uh, before HEMIGARD was invented, and that resulted in a wound dehiscence. Took 6 months to heal, and also then developed a hardware infection and needed a trip to the OR for hardware removal and 6 weeks of IV antibiotics. Our vascular doctor colleagues like HEMIGARD for its blood flow sparing characteristics, especially that distal flap when it's flipped up, often would get skin edge necrosis. We're seeing better outcomes in our amputation surgeries now. We're collecting a series and hope to publish that in the next year. This is Achilles surgery. This was a Haglund osteotomy with Achilles detachment and reattachment. You can see here the HEMIGARD was shortened with the suture scissors in one hole, and that just allows the insert to ride better on the curved posterior Achilles area. The first thing surgeons do when they get HEMIGARD is treat their own dehiscences because it's a common problem in foot and ankle surgery. On the right, there's a TMA that had partially dehisced, revised in the office with HEMIGARD. On the center panel, this was a tendon release at the first go around, sutures toward the anterior skin. The second revision was done with HEMIGARD, took all the tension, and that prevented the sutures from tearing. And it's great to be able to stop a dehisced wound from becoming a chronic wound and entering a very difficult, expensive, and labor-intensive category. We don't like wound dehiscence. Open reduction internal fixation. HEMIGARD's been used to allow patients to begin immediate range of motion and weight bear sooner than they might otherwise. Doctors have been using the HEMIGARD to allow earlier range of motion again, and they will often remove the staples before the HEMIGARD so that you take staples out in a week or two, but leave the HEMIGARDs in place so that during the stress of motion, there's still that extra protection in place. We've had benefit from earlier motion, especially in the COVID-19 positive patients who have a higher risk for DVT. So getting them to move right away with HEMIGARD is a big advantage. This was a fourth, fifth ray amputation, granulating wound that had been attempted to be closed twice. This third time they closed it with HEMIGARD, very high tension, no undermining of this dorsal foot skin, which in my hands and most people's hands would be risky for perforator injury and skin ischemia. But in this case, they were able to advance the skin significantly without ischemia and close most of it. The part they couldn't close, they used thermal matrix graft. You could certainly use a autograft here or come back in a week and try and close it. We've had people use HEMIGARD in conjunction with negative pressure therapy. HEMIGARD is a tool that allows you to do high tension skin closure and then support the repair post-operatively. And it can be combined with all the other tools. But this is a unique advantage of HEMIGARD, and gives you capacity to do things that you can't do up till now with conventional suture without the suture tearing the skin. HEMIGARD aftercare is really simple. You just keep it dry, and if the edges of the tape start to curl up, we ask that people tape them down. Finally, it's really easy for your staff to use. It's sold in suture boxes and packs. Each peeled pack has 2 strips, one for each side of the wound. They pop that open on the back table and ready to use it and make your life easier and your patient's life easier and close more wounds, uh, support the healing, less dehiscences, better surgical outcomes. And that's what we're all about. So we wish you a lot of success and with HEMIGARD. Thank you.